We have discussed that there's a way for women to find the, I don't know how to put this, the pH levels of their vagina. Is that how I should say it?
That's exactly right, yes. Good.
Let's have a look at the self-test kit and just show me how it works, and how do I know if it's the level is too high, if it's too low, if I should worry, if I shouldn't worry.
Okay, cool. So this is commercially available. See, it's called Femina, and you basically buy it off the shelf. You don't have to get a doctor's prescription for it or anything. And there are 2 in the pack. So you just open it. Don't throw away this, because you're going to need the color strip to test. Okay. Then you just take this and you put it into your vagina as if it's a tampon, more or less, but not as deep, because you're going to keep your fingers on that part.
I see.
It is corrugated like that, so that's how you know this is where you hold it. And then you basically just go into the vagina, you swirl it around a little bit in there, keep it in there for a while. If you have a discharge, it will just go straight onto that easily anyway. If you're very dry, it might be a little bit more difficult to actually get vaginal fluid to get onto that part of the test strip.
I see.
So then you take it out, and that's it. It colors immediately. And then you've got your control paper here. So if it is this greenish color, then it is normal, and the more blue it becomes, the higher the pH is. In other words, the higher the likelihood is that you could have BV. This is not a test for bacteria. This does not tell you that you have abnormal bacteria. It tells you that you probably have too little lactobacilli, that your lactobacilli are not doing its job producing enough acid. And the environment is now such that a bacteria might overgrow. Okay, so this is not a STD test.
Got it.
Doing this and finding this as normal. You can still have syphilis, hepatitis B, gonorrhea, HPV, anything you can imagine. This is just telling you the pH, and if the pH is high, the most likely cause for that is BV.
Okay, got it.
Okay.
Seems like an easy test.
Yeah, I think it's great. You know, I really think that this thing is going to put the power into women's hands to look for the infections themselves and go to the doctor and tell them, I really think I've got BV. Because patients come in here and they say they've got a discharge, and I have to go, okay, is it normal? Is it Candida? Is it BV? And really, if you look at the research, if you ask 100 doctors like me, look at these 100 patients, the doctors are really not good at telling you who are healthy and who's having an infection by just looking at their discharge. It is very difficult to tell. There are extreme cases where you can really see, and you can see, no, this is like, it looks like pus running out of the cervix. That's not BV. You know, BV is something that sits in the vagina. BV is not in your uterus. It's something that sits in the vagina. And that's why when we get treatment for BV, we can use like a cream, a gel, for instance, treats your BV. You just put it into the vagina every night for 5 nights,